everyone. It's Dr. Cami Benton. I'm here to welcome Dr. Justin Dick, one of my favorite chiropractors that I have learned so much from. And he has helped me and my family significantly with our own back issues and scoliosis. I see people coming from all over the country to see him, and I'm so thankful to have him on the show today. I these are I have these people on because I wanted to know this kind of stuff when my kids were little, and how I can do real prevention. Real prevention starts in the womb, even and at birth. So, an example that I wish I would have known is that my middle child, she was born via C-section, and they vacuumed her out of the C-section. So, it was not even just a C-section. I remember laying there and I'm like, it's taking forever. I'm like, what is going on down there? And they're like, well, we can't get her out. So, we're trying to use a vacuum to get her out. I'm like, there's a big gaping hole down there. What do you mean you can't get her out? Right. So, you can imagine the trauma that she had from that vacuum out of the C-section, where she didn't even have the chance to even naturally go down. It was honestly, in retrospect, a totally unnecessary C-section. That's a whole other story for down the road. And then 2 years later, she fell down an entire flight of stairs. She seemed okay, but I have a suspicion that that birth injury and then the falling down the stairs led to her later chronic back pain and neck pain. She's a teenager and has had chronic neck and back pain since she was probably 4 or 5. And and gosh, like, imagine if she would have just gotten adjusted, like, at birth and, also just after a full flight of stairs, like, falling down. She seemed okay, but I think she wasn't really okay. So, anyway, I just wanna hand it over to Doctor Justin, and I'd love to hear, like, also for you to tell people your inspiration because there's other things that you help with even, like, my daughter, her tics, her she had facial tics that went away just after 2 or 3 months of adjustments with you. So it's not just about I know you're here to talk about scoliosis and the spine, but I'm actually okay if you talk about other things too, because there's so many cool things, that if parents knew when they were younger, that we could prevent so much issues down the road. So I'm handing it over to you, Dr. Justin.
Well, thank you. Thank you for having me on, Dr. Benton. It's great to be able to work with you and continue this relationship. Dr. Benton's been treating almost all of my patients for a good portion of my practice. So thank you for taking good care of my patients. They absolutely love you. So if you haven't reached out to her, definitely reach out to her and get in there. Um, yeah, the birthing process can be absolutely traumatic for both mom and baby, right? And nobody really prepares mom or dad for that. And then the baby doesn't have a choice, right? So if the spine's the number one, four, and six reason for chronic pain disability in the United States, and the first trauma we have is getting vacuumed out of mom, that doesn't set very well for baby, right? So we have all these ligaments. There's 220 ligaments in the spine. And all of a sudden, all these ligaments get damaged on first seconds of being born. Now, nobody rehabs that, right? We don't work at it. Baby can't talk to you. They just deal with it. And then we have repercussions later in life from that. Or if we fall down the steps, we might not feel that bad, but we do have repercussions from it, right? In particular, in my situation, I had seizures from my spinal injuries. And that's why I got into this. I haven't had a seizure, taken a medication in about 14 years, all from an injury up here in the top of my neck, up in here. We healed that, and my seizures went away, right?
Wow.
So, how does your body respond? I don't know how your body will respond. I can tell you when I see X, Y, or Z that I know things aren't functioning properly.
Mm. Wow. I love your seizure story. Because people think, oh, oh, the chiropractor just keeps you coming back every week, and for a while they're just popping your back. But what people don't understand is that like your nerves come from your spine around to your body, and you're innervating organs and your sensations, and like it's your body. It's like it supports your immune system. But yeah, the blinking eyes, I tell you, my daughter had this she would blink her eyes. That was um, her thing since, like, actually her vaccines when she was in kindergarten. Um, she started with the facial tics, and she couldn't believe it. I didn't even take her for that. I was taking her for her neck and back pain, and then within a couple months, she stopped doing that. That was a that was so important for her as a teenager to not have to deal with that. That was a big help for her socially, so thank you for that.
I can only imagine. I can Teenagers are so cruel sometimes, I can only
Mhm.
imagine.
Mhm. So tell me more about, the scoliosis. There's also gosh, what was it? You had I'd connected you with, Doctor Luis Crespo about the mouth. Tell me about the sort of the spine, and the oral things too. That was a
Gotcha. Dr. Crespo, he's brilliant. I've been studying scoliosis and biomechanics of scoliosis my entire career. And he definitely put together some pieces that I was missing, and I knew it was missing somewhere. So if we look at the spine, from the front, we want to be straight up and down, and from the side, we want big curves in our neck, right? And without these, every doctor in the world knows that it's not going well, but nobody knows how to put it back there. That's where my postdoctor comes in, structural correction, but you have to be really, really good at spinal injuries. And so I was talking with Dr. Crespo. I was talking to him about here's what I see with scoliosis, and every scoliosis patient is missing these good curves that we're supposed to have, which induces bad curves. So Dr. Crespo broke it down a little bit different for me with we see a high prevalence of lip ties and tongue ties in scoliosis. What happens is that brings that head forward and it starts to turn the vertebra at the very top of the neck. So if we start to turn the vertebra at the very top of the neck, everything has kind of a cascade effect. It starts going all the way down through the rest of the body. So we know without a doubt, 100% of the time we have scoliosis, we have a neck injury, we have rotation in the spine, and almost guaranteed we have forward head posture and some lip ties or tongue ties. This is where somebody like Dr. Crespo comes in, just absolutely amazing. Because if he can get to them beforehand, I have a sneaking suspicion that you'll be able to eliminate a lot of these symptoms, a lot of these cascade effects later on.
right. Now, I know I have other speakers talking about the tongue ties, and not everyone has to have their tongue tie released by any means, but that's why I love myofunctional therapy first. But what I didn't even know until the last couple years is that that tongue, like your fascia here and your tongue tie, is connected to the fascia all the way down to the bottom of your feet. And so the person who did my daughter's tongue tie revision, he had plantar fasciitis for years until he had his own tongue tie revision, and his plantar fasciitis went away. Like, it's
Yeah, it's wild,
wow.
isn't it? It's wild. Modern medicine, as you're aware, is not just catching up to some of the things that Eastern medicine is known for hundreds or thousands of years. Like, no, we are one big motor unit. The body functions as a whole. If you break down one process, something else is gonna happen as well.
Tell me some of the, other cool things about cool cases about scoliosis. So, again, most people think, "Oh, tell people how, like, scoliosis even happens." Like, most people think they inherit it. Do you inherit it? Is it injury? Like, how can they prevent it? Because I think that's something that a lot of parents worry about for teens is scoliosis.
Gotcha. Great question. And the first thing we should start with is the basic biomechanics, kind of like your daughter. Like, what happens? What happens to the neck? What happens when we bend forward or bend backwards? Right? Are we functioning appropriately? We know that 100% of scoliosis cases have abnormal mechanics in the spine, which means it's not working like it should. Right. So how did it get there is the big question. And I think that's the question that you're focusing on. I wrote a paper last August that published in a peer-reviewed medical journal that says every scoliosis patient has an injury in the neck. Now, how did it get there and when did it get there? Scoliosis is generally found at age 12, right? By that time, it's already there. It's already retroactive. This is where you come in great. Let's be proactive about our health. Let's eat good food. Let's do good stuff. If you need a medicine, yes, we're here for you, but let's be really proactive. And so we want to make sure that our spine is properly in place and is functioning properly early. Because we know that that spinal injury is there. It's just when did it get there? Now, scoliosis is predominantly about 70% girls, right? And there's some different theories on why it's there, but there is no genetic component to it. I don't care what any doctor says. Never seen it. We have a gene for almost everything known, almost every diagnosis, but there's no gene for 2 to 3% of the population. So I don't believe it. What I do believe is this is where Dr. Benton comes in, is we know that scoliosis patients have a deficiency in certain vitamins, right? Deficiency in certain vitamins can also create the ligaments that hold the spine together to become problematic. So if we get into the different genetic components of that, with some of the MTHFR gene coming in and not absorbing vitamins like we should, that could become problematic as well. So we know that we have spinal injuries or the body not functioning properly. And we also know that we're not absorbing vitamins like we should be. So it doesn't matter how many vitamins you're taking. If you're not absorbing them, then it's not going to function right.
Which vitamins are they that are associated with scoliosis?
Well, we know that as a whole, they're just not absorbing much of them. Like we have a deficiency in melatonin. We're not absorbing vitamin B's, right? And so when we get into some of these link right into the soft tissues. And so if the soft tissues aren't functioning properly, then we know that we're not going to go properly. This is why, methylated vitamins are some of the best vitamins that we can get for, this population.
Right. So you have, and just for listeners, about 60% of the people don't have any methylation impairment at all. About 40% do. And 10% of those, 10% of all of them actually have pretty severe methylation issues. And that's where, just for people out there listening, those 60% of people don't necessarily need special vitamins, but unless you get tested, you don't really know. So it's just better to do methylated vitamins unless you get tested to show you don't have any methylation issues. So that's just as an aside there.
A
What
super
other,
important
yeah,
note.
hmm?
Super important note.
Yeah. So, so what other, so how, so if you were to have your top list for a family physician or a pediatrician to check in kids that could prevent could like basically address this before they're 12, like before like puberty, like what would you want us to look for?
Gotcha. I proposed in the last paper that we take weight bearing x-rays earlier, right? So, my background's radiation physics, nuclear medicine, and everybody's scared to death of radiation. And you should be to a point, right? If you're sitting in radiation all the time, if you're getting mammographies all the time, if you're getting CTs all the time, yeah, it's a problem. But if you're just getting an x-ray here or there, it's actually not that bad as everybody thinks. So getting X-rays early, getting tested by Dr. Benton, with some methylation early, and kind of getting baselines of where we're at. That's my recommendation from weight bearing age. So maybe five, you know, age 5, get your first X-ray of a front view and a side view. Where are we at? Right, and then we can say, okay, are you, predisposition to this moving forward? We can correct this right now before it becomes a problem. So we know we can find scoliosis a couple of years before an X-ray can, based on the neurology, right? So there's different neurological tests you can do. So if scoliosis is a rotation and a lateral bend, which means a sideways curvature of the spine, that puts torsion in your spinal cord. So we can pick up on that torsion earlier than an X-ray can. So that way, if we can find an X-ray early before it all comes out and that torsion is there, we can hypothetically work on preventing it.
Mm. So now you're specifically trained. You have like a beyond normal chiropractic school. You've gone to do a fellowship and all that, right? So let's say because you're kind of special for what you are within the chiropractic field. What would you recommend parents like, because you're helping people with scoliosis and regular people, you're doing maintenance things and prevention as well, but there's only one of you. So for people who live further away and they're going to a regular chiropractor, like what are some things that they should ask their chiropractor about that could help them prevent this? Like you'd think a good chiropractor should know a lot of this anyway, but just like in medicine, just like in whatever profession, you have some that are more in tune to this and some that are not. So, what are some questions that a person could ask when they're taking their kid to another chiropractor for this kind of topic?
Gotcha. Great question. And this is why I continue to advance. And this is why I continue to research and publish because not everybody understands these concepts, right? I have a $250,000 education. That's what it costs to be a chiropractor right now. Uh, and you're taught to be a spine specialist, but you're never taught what spinal injuries are or what to do with scoliosis, right? And so if you're going to your local doctor and they see anything abnormal, right? You want to start asking questions. Okay, what are we going to do about this? What are our objective findings for this? So we work in a world that's heavily objective, meaning your lab results, they have definitive numbers on them. Your x-ray should have definitive numbers on them. Do they change? What happens? How do we get them to change? Right? So we want to talk about what are we going to do for definitive results? And that's where I would go with a local chiropractor, say, okay, we see this, but when is it time to interject like Dr. Justin, right? When is it a scary time where Dr. Justin has to jump in and really help things out? And then we can go back to our local chiropractor. And so those are the questions I would ask is, we have these objective results. What are we going to do with them and how are we going to do it? And then do follow ups with that. Okay, maybe 3 months do a follow up. Did things change? If they didn't change, why didn't they change? Do we have to do something different?
I was one of them. Of course, I'm a Western trained doctor, and although I started pretty early on with chiropractors for my migraines. I used to get a lot of migraines, and actually, it's kind of a funny aside, but I worked in a practice with a bunch of other doctors, and I had to go see the chiropractor during lunch real quick. I mean, because I was having a migraine, and we are all eating lunch. I was like wolfing it down. I was like, I gotta go. 'Cause I gotta go to the chiropractor for my migraine. And the older guy was like, "Why are you going to see a chiropractor? They can't help migraines." I'm like, "No, they can't help me at all. That's why I go to them for my migraines." Like, it's so impressive, and there and the interesting rhetoric of medical doctors, like, against chiropractors. There's definitely a training it was definitely in my training anyway to go against, chiropractors and, like, some resentment. I remember learning about chiropractors helping ear infections, and I remember learning about that. I remember exactly where I was sitting when they were, like, making fun of chiropractors, treating ear infections, and, like, only antibiotics could ever help an ear infection. What quacks, right? And I remember like, huh, I remember this moment back and I didn't know anything about chiropractors. I was not raised holistic at all, but I just remember that just stuck with me for some reason. And then, of course, we send people all the time to chiropractors for their ear infections, which is
Mhm.
hilarious, because I'm like, yeah, I don't even need antibiotics most of the time for my patients. But anyway, I went there for my migraines, and then during pregnancy, same Sophia, my middle child, her that pregnancy, and I started with pain around like it actually was radiating below my left ribs during pregnancy. And I was like, what is going on? I would just push in there, but it turned out eventually I was able to track it to more thoracic spine. Eventually, it got worse where I could feel it in my thoracic
Mhm.
spine. And I saw chiropractors, like, and I had many different chiropractors. I love them all. Like, there's it's kind of nichey. You like this chiropractor for this, and this chiropractor for this, and
Mhm.
everyone has their sort of skill set. But no one took any X-rays. And honestly, I was like, kind of one of those. Oh, you don't need X-rays all the time, because I'm a chiropractor. As if I knew either. I made my own judgment about it. But all those years, nobody did an X-ray until where you saw my scoliosis around my thoracic spine. I'm like, "Well, that would have been nice to know." So then you put
Mhm.
me on the regimen, and, within 2 months, you decrease my degree. I think it's 4 degrees that you took off my scoliosis. Um, and then honestly, I was terribly non-compliant after that to be able to follow up to anyway, that's another issue that we'll have to talk about down the road. Um, but I was like, wow. It's like that for me changed my understanding of the importance of having at least a baseline x-ray for every chiropractor should have a baseline x-ray. I was surprised at how many did not do x-rays. You know, wow, tell me more about that.
I mean, chiropractic is a very funny field. This is not my first profession. It's a very divided field. Some doctors think I'm a heretic, right? So I come from a medical
You're
practice.
in good company with me as I
Yeah,
hear.
I know. I'm like, well, here we go. I'm okay with that because my publishings and my results don't lie. It's not that I just got somebody's ear better or I got a scoliosis better once in a while. No, these are consistencies. When we can prove consistencies, it's a whole nother ballgame. So chiropractic, if you talk about medicine, the chiropractic profession sued the AMA and won against slander. I think it finally finished up in the 90s, maybe.
Mm,
And so it was a huge, rub early in our careers. And that's why I still think that the AMA and the chiropractic profession doesn't get along very well. I don't know why, because we're dynamic together. As long as we
right.
stay in our own lanes, it's fine. This is why almost all my patients see you, which is great. We can work very well together. But as far as the X-rays go, it's really funny because I'm a very small percentage of the doctors that say, "Oh, look, when the spine isn't right, let's put it back like that." Every chiropractor knows when the spine's not right, but nobody's taught how to put it back like that. And so this is why publishing is so important, that it's, "No, we can do this. You need to get better." And so this X-rays are, super important. Otherwise, how do we know what we're doing?
Right. I was
Right?
impressed because you were able to show me in your office, like, the angles, like, yeah, that computer program that, like, you're drawing lines. I'm like, "Whoa, my back is a hot mess," like, but you're able to see because you always hear, like, "Oh, the curvature of the spine's not there." It feels like the same kind of recipe, uh, that you get, but then you're like but you're able to show, like, "Alright, here's your angles 3 months ago versus now." When you're following the regimen, you're like, "Oh gosh," like and then, like, I had a pain up here, like, years that was just like I couldn't even look up for years, and when it was finally gone, I'm like, like, I thought I was gonna live with that pain forever, but it
Mm,
wasn't because I wasn't going to chiropractors, like, I just didn't I don't think that they were following they didn't have the baseline data to follow up afterwards. I'm not saying they're bad. I mean, they helped other things, I guess, and I know they help other people. And again, I mean, there's been some incredible ones that still didn't take an X-ray, but they like I like there's the what's it called? That it's like more energetic kind of
uh, there's plenty of energetic
oh
ones.
gosh. Anyway, like I
There's like
get it.
NSA, that's network spinal analysis, this gateway.
Network, chiropractic or something like that, yeah, I
Yeah.
think it's where they half times they're not really doing any adjustments anyway, it's more of a nervous system thing. I was like, "Okay, fine, I get that, I guess." Things don't get better than doing X-ray. But anyway, that was definitely a big lesson for me is understanding the importance of an X-ray and a chiropractor, which is seems obvious. Of course, you're dealing with the spine.
Think so. You would think so. Some of my best referrals are, "Man, I've been under chiropractic my entire life. Why does my X-ray look like this?" Oh, that's a really good question. Let's talk about that.
Let's talk
Why
about
does it
that.
look like that? Right? Because we know when the spine isn't in alignment, this is, you kind of mentioned I'm a geek. So when the spine's not in alignment, we have abnormal load bearings, right? And so all of a sudden, part of our spine starts to break down much faster, like 2, 3 times faster than everything else. Now all of a sudden we're like, "Well, why do we have degeneration there? Why does my hip hurt?" Well, you've had abnormal mechanics for years, of course it breaks down.
Yeah. Tell me what it's like to get treatment for scoliosis in your office. Like, tell me about that.
Well, that's a tough question. A lot of our patients we do intensives with. So a paper that I just had indexed this week is based off a 2-week intensive. So if we make changes very, very quickly, we can move things along and make them stay a lot faster. And so I think we take, I don't know, it was in this paper, it was 2 patients I started at the exact same time with a year follow-up. I think it was 12 degrees off their scoliosis in the 2 weeks that we could do. And then it continued over the next year. I think we took, I don't know, like 14 and 16 degrees off their scoliosis, something like that over a year's time. But the intense model is the biggest part, right? So if we're working with getting things to change, we have soft tissue in there, which is our ligaments that surround our spine. And if we get those more elastic, so we stretch them out and stretch them out, the longer you wait in between getting them to get elastic again, the more they kind of freeze back up. So if we make it elastic and make it, malleable really quickly, and then come right back again and make it malleable really quickly, then we can start moving things easier. And then it gets to stay where we want it to. So we work in a mix, fix, and set, warm the body up, move it closer to where it should be, and get it to stay. But it's kind of like going to the gym. If you only go to the gym once, well, that was really good. But if you go to the gym 4 days a week, you can make changes much faster. And so some of my patients are, most of my patients are from around the world, and they're here for 2 weeks solid. And we make massive changes like they say we can't. We make those massive changes, then I send them back to their chiropractor or their MD or their physical therapist, wherever they come from, and say, "Here's what we did. Continue to follow up and send me an X-ray in every 90 days."
I think that's where you make a big difference in chiropractic. Sort of like me, I was like when I'd have people come from functional medicine and would do the overhaul, their doctors didn't believe in this, but then they go back feeling so much better. And they're like, "Can I stay with you?" I'm like, "You can, but I'd rather you go back to your primary care and show them how much better you are and that might inspire them to be more open to this, you know? It's like, I we want this to spread, this knowledge that people really can heal and get better. Of course, I do love chiropractic along with deep tissue work as well, just the nervous system and people who are stressed out, like, if because I can say from personal like, when you saw me for all my issues, I was going through major stressful times in my life.
Mm.
Now that I'm happy, I'm like, "Oh, I have no pain." Great. You know, this is something also for people to realize. If you're holding on, you're stressed, you're carrying the weight of the world on your shoulders, you know, you're
Well, the body keeps a
there
score, no doubt about it, and you see it in labs, I see it in chiropractic, we see it in our energy work, you see it in your mood, you see it all over.
right. It's just it's incredible how much less pain I have now that life is great and happy.
I'm so
So
happy
it's
for
just
you. I am
yeah,
so
it's
happy for you.
yeah, yeah, yeah. It's very important for people to know that too, and also still thinking about your kid. Kids don't complain about pain for no good reason.
Mm,
Like, kids are not hypochondriacs when they're 2 and 3 and 4. Like, again, I remember my daughter complaining, but I'd take her someplace and just nothing ever really happened, and you just kind of I was in survival mode myself and trying to get through, and now I'm like, "Oh gosh," it's those things you had to deal with as a mom, like, "Oh, I wish I would've, but I didn't." So, but take your you if your kid complains about if your kid is limping or they're complaining about neck or back pain, you take them in, like, you don't blow that off. Kids are not lying about that kind of thing.
mm.
They don't lie about that kind of thing. They're like little animals. They're not already, um predisposed to, like, making up stuff. Yeah, like, they can make up stuff. They might be a mermaid talking underwater, but they're not gonna be having pain in their neck or
Yeah,
their
we would definitely wanna be proactive, and that's who you are, right? That's who I am, be proactive. At most, in any book I've ever seen, the nervous system is 30% pain. Right? So when do you feel a heart attack or when do you feel that stage 4 cancer, right? When do you feel that broken bone? It's already too late. You should have been working about this a long time ago.
mhm.
So being proactive is the number one, even if it's just, hey, I got an X-ray, everything looks good, or Dr. Benton drew my labs and everything looks good. I did this study, everything looks good. Great. Now you have a baseline. Now you can go back and recheck that after a year if you need to.
What are some other common childhood conditions that can be helped by chiropractic care? Like, for instance, ear infections, like, that was
Yes.
one that I use all the time. I send them straight to their chiropractor, like, "Don't come see me first, because even if it's infection, is most likely a viral infection. You still need to see the chiropractor first or do homeopathy. But I don't want to give you antibiotics. Don't come see me right now. Yeah. So what are some other common childhood conditions that you see that could be helped by chiropractic care?
Gotcha. So, the research previous before I started getting into it was ear infections, back pain, and blood pressure. That's chiropractic. That's pretty much the research. I can tell you this week, I saw somebody that had, week over week seizures. That was an 8-year-old boy because he fell and hit his head, negative MRIs, negative CTs, negative x-rays, right? But he hasn't had a seizure in the last 3 weeks, right? All from a spinal injury that was in his neck, right? And so that was really good. I had a 2-week-old child in this week that the pediatrician said, well, their nervous system's on edge, right? We need to start talking to him about getting him some medication because the kid's not sleeping. I'm like, well,
What?
we adjusted their atlas, and the kid passed out in my hands. I'm like, "That's
Mm,
not what happened." The kid was very colicky because this has a problem up here, It just like your daughter getting vacuumed out, it's gonna create a problem, of course, we have to adapt, get that to adapt. And this was a C-section baby as well. And so that was this week, right? Neck pain, back pain, really common, but allergies, migraines, right? These are really, really big things. Neck pain, obviously, ringing in the ears. These are all related to spinal injuries, which is the body's not ability to not to adapt appropriately. Right, and so an adjustment, if it can boost your immune system, come on in. If Dr. Benton is sick, I wanna see her 2 or 3 times during the day. That's great. Let's get that body functioning the best it can be. Yes, also do your homeopathies. Yes, also take your zinc. Yes, also do your vitamin Ds. But this is an easy way to get the body to function even better every time. Specifically, if we have, abnormal biomechanics and we start restoring that, the brain and the body can talk better.
right. I was until COVID happened, like, it was people are like, "Oh, yeah, I can do this." But during COVID, people got scared to, like, take in illness and things like that. I'm like, "This is even more of a time to get a chiropractic adjustment, really." Like, everything we could do, that was such an I was very thankful for all the chiropractors in the area, that they were just like, "Nope, come on in, y'all. Come on in, like, we can take care of you." They were not afraid. The doctor's offices were afraid, but chiropractors were not afraid. I'm really thankful for the understanding of chiropractors, understanding of the immune system and how they can support that.
Yeah, we're definitely a different breed, most of us.
Yes, most of you are. Most of you are a different breed. Uh, uh, what are some of your favorite cases, that like mystery cases?
Mystery cases. That's generally my MO. So if you go on my, go read my
You're
Google.
like Dr. House, in other words, right? You like Dr.
Yeah,
House
yeah,
chiropractic.
but, it's Dr. House of Chiropractic, that's for sure, right? So when nobody else can figure it out, I got the multiple diagnoses is kind of my favorite. I have MS, I have chronic fatigue syndrome, right? I also have IBS, you name it. Please don't take this wrong. I don't care what you call it, right? It's the body not working properly. So yes, I've taken those classes and I passed those board exams, but it doesn't matter what you call it. It's the root cause of what's actually happening. So some of my favorite cases are these people that, they're on disability. They're 30 years old. They got MS and they got all these things, right? You start getting the body to restore itself, start to get to function, and all of a sudden they can walk again. They're told they're never going to walk, right?
Mhm,
They're out dancing with their husbands, right? They get their lives back. This is the most important thing is they get their lives back, right? Yes, I get to be a part of that, but you just changed somebody's world, and that changed how many other people's worlds. Right, and so generally, it's when you get these cases that are told that, "Sorry, there's nothing we can do for you." My wife is a prime example. She was in her 20s on, I think it was 14 medications. She's told she had precancer, ovarian failure, migraines. Her body was shutting down. Her immune system was shutting down. And I said, "Sorry, you got about 6 months to live. You're gonna be permanently hospitalized." Right? That's not true. I had 2 kids at home. She has 1 migraine in 14 years, right? Her allergies went away. Her random fevers went away. Yes, we changed our food. We eat organic, right? We eat healthy. We do healthy things for our body. But the biggest change initially was the chiropractic. We
mhm.
started rechanging her structure and oh my goodness, life changed. She got her life back compared to being on a medicine the rest of her life. What was going to be shortened at that time, right? These are the stories I live for.
Yeah, so what would you say to people? Of course, I have my own suspicion as I'm sitting in this desk all day long underneath fluorescent lighting, you know, but why do you think that people need chiropractic care now more than maybe they would have 100 years ago? And honestly, I'm sure they still needed it back then. I'm sure there were plenty of people who like would have wished for a lot of stuff 150 years ago. But like what are some of the factors especially like for kids um including kids, again, trying to bring the kids thing back into it, that is setting people up for the need for chiropractic care.
Yeah. I'm confident most everything boils down to stress on the body, right? Stress can be chemical, emotional, physical, or lack thereof, like lack thereof vitamins. These all stress the body, and the body has to adapt to it, right? So if it's a vaccine, the body has to adapt to it. If it's not eating right food, the body has to adapt to it. If you're eating, or if you have clothes on that have chemicals in them, the body's going to have to adapt to it, right? And so the body gets under stress. And what happens under stress? Generally not very good things. We're in a fight or flight mechanism, right? So we're either fighting or running away. And then all of a sudden, compound that with years and years of that, the body starts to create issues, in my opinion. And all of a sudden now we're a retroactive, right? Rather than being proactive and taking our vitamins, doing, eating right foods, being clean, eating good or having good detergents, not using all the chemicals. Now we're retroactively saying, okay, well, how did I get here? And if you go to modern medicine, they're going to give you a medication. Well, the medication just masks it. It doesn't actually solve any issues. Getting to root causes of why is that stress there and starting to deal with that stress, even from a young age of just being a baby, right? All of a sudden now you get all these vaccines. Like, why would you do that? Right? We didn't have these 100 years ago, 140 years ago. We didn't have the chemicals in our foods. We didn't have all the detergents. We didn't have everything we're dealing with today. And so it's a working with our, trying to de-stress our body today, I think is key.
Something else I think about, is again, thinking about sitting at a desk all day, like, the sedentary behavior is, like, gonna kill us
Mhm.
all, right? The sitting all day, but as kids start sitting all day pretty early on in their life, like, yeah, kids are in school desks, like, way too long, like, I wish we just didn't even start kids in school until, like, they were, like, 9, like, that was in a regular, like, setting, like, at least let 'em I wish we could all do Montessori type schools, like, in earlier ages, that kids could play and be creative and climb and everything, but even, like, thinking about things that we didn't have 100 years ago, we didn't have all the bouncy seats and the car seats and all the things that we put our kids into, like, babies need to be crawling their world needs to be the floor, really, and even the baby would carry them constantly, which is sweet and wonderful, I would say I still love the 4th trimester, call it 4th trimester, like, for the first 3 months holding the baby more, and all that, but as the baby is really wanting to move around, put them on the ground and not in bouncy seats. That's something that, when you think about the baby registries, we can save a lot of money and effort and, like, stuff if we just, like, put a little blanket on the floor
The
and let
baby's gonna be healthier, it's gonna function better from my perspective on the neurology side, because that's what I would care most about is the neurology side. It's gonna build left brain, right brain, common yours. So it's gonna function better, it's gonna adapt better, it's gonna come in contact with all kinds of microbes, all kinds of viruses, it's gonna build an immune system. The body as a whole is just going to function so much better when we allow baby to be baby.
Yeah, let the baby on the floor, y'all, like, the baby needs to be crawling around and people you don't need them skipping over things, like, it's important for the baby to scoot, to crawl, to climb, and then eventually they'll walk. But if you're holding the baby so much I've literally had, like, some moms, they just hold the baby so much they're not walking because they're being held all the time. And
Yes.
and but it's important for them, like, this position, is pushing up and reaching and looking around, but when they're stuck in that little chair and they're like they're not getting normal neurologic development. So it's important for parents to know that. And again, like encouraging, gosh, the TV and the just don't put your kids on any video TV things when they're little. Just don't do it. Just don't, because that was actually one thing another chiropractor did for me that was super fascinating. I was started getting a frozen shoulder many years back, and it was actually a psychological trauma that brought on that frozen shoulder, interestingly. That's another discussion. But it's interesting, at first I could feel it coming on, it would just get stuck, and then he had me look at this he had this red and white scarf and had me tracing the red and white scarf over and over again, and I had better range of motion just after doing that, and what he had told me is that we spend so much time looking into the screen that our brain stops firing to the different parts of our bodies. And so just by me exercising my eyes in a certain direction, I increase firing to my shoulder. So
Mm,
people do need to understand that with kids like staring at the screens, us staring at our computer all day long, we're like we're getting weaker in the areas that our brain should be working with our body. So this is where climbing trees and swing sets and just whatever, bending over and picking up things is that motion that actually keeps us alive. But if we're
yeah.
sitting here staring like little zombies in front of screens, we are losing function in our bodies. That was a very fascinating experience for me to see that, like, oh my gosh, I need to figure out how to look around. I found myself working all right, can we do some exercises, trying to stay ahead of that because it really is slowly destroying our bodies, the sedentary life that we're living. I don't know if you have any stories
I
about
know
that, but
it's a huge concern of mine. Yeah, in my house, while we have TVs in the house, I can tell you is maybe on 2 hours a week. We are a screen-free house. My kids they do we homeschool, and so they're on the screens for, I think, maybe an hour a week for their homeschool doing one of their programs. But past that, I'd say, "No, we're gonna go play outside today," or "We're gonna read today," or "We're gonna be creative today. What are we gonna build today? What are we gonna draw today?" Now we're engaging our brain, not just sedentary, like, what are we watching?
Right. That passive learning. Yeah, there's definitely so many things I would do differently for my kids. Well, of course, I was a workaholic and worked all the time, so,
Been
yeah,
there. Yep.
I don't
Still
know
there.
what to do. Um, what else have we not covered today that you would love for people to know about? I would say, wow, since we talked about adults and kids, like,
So I think the last thing that I'd like to cover that is super important that most don't understand, including myself for years, as if the spine is the number one, 4, and 6 reason for chronic pain disability, right? But that doesn't mean it doesn't have all the other symptoms, like ringing in the ears or jaw problems or eye problems. Because yes, I've seen people psych it better, or or breathing problems, post concussion syndrome. 1/3 of concussions come from the upper neck. 1/3 of them. That's medicines talking, right? So nothing today I've said is Dr. Justin saying anything. We go back to the AMA standards and say, here's what literature says, here's what this says, right? So your body is meant to be it's really fragile as a whole, right? But it is really strong and it will adapt. Your car is meant to take a 10-mile-an-hour car accident, right? It's meant to take that without a scratch. Your body's not meant to. So imagine you're in a car and you get into a small fender bender at 10 miles an hour. You're in a seatbelt, your head gets whipped. It takes 10 pounds of pressure to ruin these ligaments that hold your spine together. Right. So you might not feel like anything's bad. You're heading a ball playing soccer. You might not feel like anything's bad at that moment, but that night we start to get groggy, right? We're having concussion syndromes. We might get nauseous. Those are spinal injuries. Those are concussions, right? And back to the AMA standards, that's actually a 20 to 25% whole body impairment rating if you don't recover from it, which means how much of your life is going to be impaired at that moment for the rest of your life. These are things that aren't discussed because nobody analyzes them. Right,
mm,
and so it doesn't take a whole lot for the spine to be injured. It takes a doctor understanding how to rehab that injury to get you functioning back at your life, right? So say you get that 10-mile-an-hour car accident, 20 years later, you're like, "Oh my goodness, why do I have all this degeneration in there?" It's because it wasn't addressed on day one, right? These C-sections, all these other small injuries when we're young aren't addressed when we're young, and so now we have chronic conditions later on.
I definitely, I'm still shocked at how, um, horrible is standard of care for concussions and injuries. I mean, I'm shocked at my sister was in a head-on collision. This guy fell asleep and hit, like, 5 cars,
Mm,
and she was found, her car she was found in a ditch about half a mile down the road, and she was, like, knocked out. So she went to they finally found her. It was OnStar that actually told the police that there was still someone out there.
good
That's
news.
literally like, otherwise, they would have left. That's how far from the scene she was in a ditch. So they took her to the hospital, but they did a CT. They're like, "Oh, no concussion." You're like, by definition, she's been knocked out in a high, like, speed. She's got a concussion. I don't care what the CT says, this is like you don't always see something on a CT scan. Anyways, they sent her home, and she followed up with her, medical provider, and still, "Oh, yeah, you got a concussion, stay home and rest." And I'm like, "Rhonda, girl, you need to, you're getting sick, you need to go to the chiropractor, go get some acupuncture." At that point, I didn't even know about hyperbaric oxygen, but now I would say hyperbaric oxygen, a homeopathic arnica, and go frequently until you get better. But, everyone's like, "No, you don't have a concussion." Well, she ended up getting confused and lost in Walmart. Now, my sister was a master's student in college teaching school. She had to drop out of her school and out of teaching. She couldn't function. She was literally like losing her memory. It was that
Mm,
fast. And so I got her into vision therapy. Um, this was years ago, and the vision therapy turned around within 3 months, but, that was incredible. But she didn't have the chiropractic insurance so I tell people, like, everyone, I don't care how little you think it is, chiropractic adjustment, arnica, actually
mhm.
omega-3s have really good concussion,
That's where I was going.
yeah,
High doses
omega-3s
of
are
omegas.
are really important. Actually, there are military studies showing how important it is. Even if you're chronically on omegas and you have an injury, you're gonna have much less impact. than
Mhm.
if you had not been on it. So it's actually protective and also helpful for the inflammation that happens in concussions. Um, Acupuncture is really great, but hands down, go see your chiropractor day one if you can. But now if you go to a regular doctor, they're like, stay home and don't look at your cell phone.
Yeah, you have that CT that your sister had. Your CT is a static image, right? It's not even functional. And so a CT is good if you have a brain bleed, right? If you have a tumor, but it
Right,
doesn't tell you if you're alive or dead. It's
right.
really not that good, right? You need a functional study of, okay, what's actually happening inside there and to determine what's going on. And if you have that concussion, man, oh, and those things that you talked about are amazing, amazing help.
Right, I remember seeing, when I learned about the micro tears, is like when you have the head injury and you see that it's soft tissue, and it's like this sheer injury, you're, like, seeing this movement in the brain, and you're having these micro kind of injuries that you don't
Yeah.
see on CT, so it doesn't really matter what you see. Now, if you see something and it is bad,
Yeah.
and it is
By the
like
time it hits that, it's already too bad. Mm.
when it's really bad when you see it, it's really bad, but it doesn't detect mild concussion. So this happens, like, you think about this in sports injuries, like football, um,
And
like
then within 72 hours, your gut biome changes. So now
yeah,
like, Dr. Benton's like, okay, what are we doing about our gut biome? Because we gotta get to get that change back to be normal, right? So this is
and
why
then
like scoliosis, every scoliosis patient has a neck injury. All their gut biomes are wrong.
right. So and then that further even impacts people's, progesterone level, like hormone levels.
Yeah. It's
Like
a
hormone
cascade.
levels is a whole cascade. Like is this is something that, um Western medicine is, like, decades behind, on as for concussion care, decades, like,
Yes.
shocked as that and vision therapy, I still had to put a plug in for vision therapy. We have SightWorks locally that can transform people who have developed, post-concussive syndrome where they have the headaches and they can't read. It's incredible,
Mm,
what they can do as well. It's like there's a whole
amazing.
team having the whole like, when there's a significant concussion, chiropractic, acupuncture, site, like, vision therapy, arnica, omegas. Anything else I'm missing there?
Ah, that's a good part.
Yeah, because kids get this, in sports, as well. So it's and just because 'cause they're babies don't mean that they don't get injuries, they just can't speak it. Like, if they
Oh,
do
yeah, it's
if there's car
I
accident.
fell and hit my head. She's just crying. It's fine.
Yeah, yeah, yeah.
Maybe not.
Yeah, yeah. Go see the chiropractor. So, all right. Well, this has been super helpful, and hopefully people can, take from this different, conditions that they will see in their families, and they will see. It's a matter of when, not
Yes,
if.
yes.
And so thankful to have, really so many really great chiropractors in the area, and I'm thankful for your specialty that you're offering. I don't know if you wanna tell us more about your clinic and where to find, you.
Gotcha. I can be found at clearlifescoliosis.com. My postdoctor is through the Clear Institute as far as the scoliosis is concerned, so you can learn more about us there. But my office will be moving down into South Charlotte off of exit 4 and 485 down there. Uh, we'd love to see you if you have any questions. I'm open to talk to anybody. I'm really an easy guy. Even if you just want to say, hey, here's what's going on, we can just sit and talk about it.
Awesome. Yeah, if you see babies all the way up until, like, whatever age, which is great.
Yep.
So I know you've helped my best friend and her grandchild and her daughter during her pregnancy. So, uh, they really sing your praises, and actually, I think you've just won their whole family to
They're great people. They're great
yeah.
people.
So,
Well,
anyway,
thank you for having me today. I appreciate it.
thank you so much, Doctor Justin Dick. You have a wonderful day, and thank you for coming on.
You as well.